Have you ever gone to bed expecting a full night of rest, only to wake up with a headache, a dry mouth, a stiff neck, or the feeling that your body never truly relaxed? Many people assume this is simply part of getting older. They blame age, stress, or a bad mattress and move on. But when these symptoms happen repeatedly, they may be telling you something important about the way you are sleeping, the way you are breathing, and the position your body remains in for several hours every night. This becomes especially important after the age of 60. As we grow older, our joints become less flexible, our muscles may weaken, and conditions such as high blood pressure, acid reflux, arthritis, heart disease, and sleep apnea become more common. These changes can affect which sleeping position feels comfortable and which position allows the body to breathe and rest properly. But before we go any further, I want to make one thing very clear. There is no single sleeping position that can guarantee protection from a stroke. Sleeping on your right side does not automatically mean you are in danger, and sleeping on your left side does not make you immune to cardiovascular problems. Stroke risk is influenced much more strongly by factors such as uncontrolled blood pressure, smoking, diabetes, high cholesterol, atrial fibrillation, lack of physical activity, and untreated sleep apnea. Your sleeping position still matters, but not because one side is always dangerous and another side is always safe. It matters because posture can affect your airway, your breathing, your acid reflux, your neck, your spine, and the quality of your sleep. And poor sleep, especially when it is caused by repeated breathing interruptions, can place additional strain on the heart and blood vessels over time. Let us begin with one of the most common positions: sleeping flat on your back. For some people, back sleeping is comfortable. It distributes body weight evenly and may reduce pressure on painful shoulders and hips. When the head, neck, and spine are properly supported, it can be a perfectly reasonable way to sleep. However, back sleeping may create problems for people who snore heavily or have obstructive sleep apnea. When you lie on your back, gravity can pull the tongue and soft tissues of the throat backward. In some people, this narrows the airway and makes breathing more difficult. If the airway repeatedly closes during sleep, oxygen levels may fall and the brain may briefly wake the body to restart normal breathing. These interruptions can happen many times during the night without the person realizing it. You may not remember waking up, but your body still experiences the stress. This is why someone can spend 7 or 8 hours in bed and still feel exhausted the next day. Common warning signs include loud snoring, gasping or choking during sleep, morning headaches, a dry mouth, daytime sleepiness, difficulty concentrating, and waking with a racing heartbeat. Some people are told by a spouse or a family member that they stop breathing for several seconds at a time. That should never be ignored. Sleep apnea is not simply an annoying snoring problem. When left untreated, it can contribute to high blood pressure, abnormal heart rhythms, cardiovascular disease, and an increased risk of stroke. Changing your sleeping position may help, especially if your breathing becomes worse on your back. But position alone is not a treatment for significant sleep apnea. If these symptoms sound familiar, the right step is to speak with a healthcare professional and ask whether a sleep evaluation is appropriate. Now, some people try to solve nighttime breathing problems by stacking several pillows beneath their head. At first, this may feel helpful because the head is higher. But if only the head is raised, the neck can bend sharply forward. The chin moves toward the chest, the muscles remain tense, and the natural alignment of the spine is lost. After several hours in this position, you may wake up with neck pain, shoulder tension, or a headache at the base of the skull. The better approach is to elevate the upper body gradually rather than bending only the neck. A wedge pillow or adjustable bed can lift the upper back and shoulders at a gentle angle. This may be helpful for some people with acid reflux, nasal congestion, or breathing discomfort when lying completely flat. If you sleep on your back, placing a small pillow beneath your knees can also reduce pressure on the lower back and help maintain a more comfortable spinal position. The goal is not to sit upright in bed. The goal is to create a gentle incline while keeping the head, neck, and upper body aligned. Now let us talk about side sleeping. Side sleeping is often a good option for people who snore or feel that breathing becomes more difficult when lying on the back. It may also reduce pressure on the lower spine when the hips and knees are properly supported. But there is a great deal of confusion about which side is best. You may have heard that everyone should sleep on the left side and that sleeping on the right side is dangerous for the heart. That is not a rule that applies to everyone. For most people, right-side sleeping is not known to directly cause a stroke. Some individuals with certain heart or lung conditions may feel more comfortable on one side than the other, but that is a personal response and not proof that one side is damaging the heart. If you have heart failure, significant breathing problems, chest discomfort, or a known cardiovascular condition, you should discuss sleeping position with the clinician managing your care. There is one area where left-side sleeping may be useful for many people, and that is acid reflux. Because of the way the stomach and esophagus are positioned, lying on the left side may reduce the movement of stomach acid upward into the chest and throat. Some people notice that heartburn becomes worse when they lie on the right side or go to bed soon after a large meal. This does not mean that left-side sleeping prevents heart disease or stroke. It simply means that it may reduce reflux and help certain people sleep more comfortably. Whether you sleep on your left or right side, proper alignment is essential. Your pillow should fill the space between your shoulder and your head. If the pillow is too low, the neck bends toward the mattress. If it is too high, the head is pushed upward. Either position can create muscle tension and lead to stiffness or headaches in the morning. A pillow between the knees can also help keep the hips, pelvis, and lower spine aligned. This is especially helpful for people with hip pain, back pain, or arthritis. Some side sleepers also benefit from holding a pillow against the chest. This prevents the upper shoulder from collapsing forward and reduces strain across the shoulders and upper back. You do not need to force your body into a rigid position. The aim is simply to support the areas that would otherwise twist or remain under tension for hours. Another common posture is the tightly curled fetal position. A relaxed fetal position is not necessarily harmful. Many people naturally bend their knees slightly when sleeping on their side. The problem begins when the body is curled too tightly, with the knees pulled close to the chest, the shoulders rounded forward, and the chin pressed downward. This can make it harder for the chest to expand comfortably and may increase tension in the neck, upper back, hips and knees. For someone with arthritis or limited mobility, spending the night in a tightly curled position may also make morning stiffness more severe. The solution is simple. Loosen the position. Allow the knees to bend naturally without pulling them tightly toward the chest. Keep the neck in line with the spine and use pillows to support the body rather than relying on muscle tension. You should feel supported, not compressed. Now consider stomach sleeping. For many adults, sleeping on the stomach places the greatest strain on the neck because the head must remain turned to one side for a long period of time. It can also increase the arch in the lower back and place pressure on the shoulders. Some people have slept this way for decades and feel comfortable. If you wake without pain and breathe well, there may be no urgent reason to change. But if you regularly wake with neck pain, headaches, shoulder discomfort, numbness, tingling, or lower back stiffness, your sleeping position may be contributing. Using a thinner pillow beneath the head may reduce the angle of the neck. A small pillow beneath the hips may also reduce strain on the lower back. For people with persistent symptoms, gradually training the body to sleep on the side may be more comfortable in the long term. There is another issue that can affect your sleep just as much as posture, and that is what happens before you get into bed. A large meal close to bedtime can worsen heartburn, indigestion, coughing, and disrupted sleep. When you lie down immediately after eating, stomach contents are more likely to move upward, especially if you already have acid reflux. For many people, finishing a large evening meal 2 or 3 hours before lying down is a sensible habit. Alcohol is another important factor. Alcohol may make you feel sleepy at first, but it does not improve the quality of your sleep. As the night continues, it can cause more frequent awakenings and reduce the amount of restorative sleep you receive. Alcohol can also relax the tissues around the airway, which may worsen snoring and obstructive sleep apnea. This is particularly important for older adults and for anyone already experiencing nighttime breathing problems. A calm walk after dinner may support digestion and general health, as long as walking is safe for your mobility and medical condition. But no lifestyle adjustment should ever be presented as a replacement for prescribed blood pressure medication, heart treatment, blood thinners, diabetes care, or sleep apnea therapy. The most useful question is not, which sleeping side guarantees that I will be safe? The better question is, does my sleeping position allow me to breathe comfortably, keep my body supported, and wake feeling reasonably refreshed? Pay close attention to the signals your body gives you. Do you wake with a headache several mornings each week? Do you often have a dry mouth when you wake up? Has anyone told you that you snore loudly, gasp, choke, or stop breathing during sleep? Do you feel unusually sleepy during the day, even when you believe you slept long enough? Do you wake with chest discomfort, severe shortness of breath, or a pounding heartbeat? Do you need several pillows or have to sleep sitting up because breathing becomes difficult when you lie flat? These symptoms do not automatically mean that something dangerous is happening, but they should not be dismissed. They may be signs of sleep apnea, heart or lung problems, acid reflux, medication effects, or another condition that requires proper evaluation. A sleep study may be recommended when sleep apnea is suspected. In some cases, this can be performed at home. Other people may need to spend a night in a sleep center where breathing, oxygen levels, heart rate, and sleep stages can be monitored more closely. Wearable devices and fingertip oxygen monitors may help identify patterns, but they cannot provide a complete diagnosis. Consumer devices can produce inaccurate readings because of movement, cold hands, poor circulation, or improper fit. Use this information to begin a conversation with your doctor, not to diagnose yourself. Your bedroom environment also plays an important role in the quality of your sleep. A dark, quiet, and comfortably cool room helps the body prepare for rest. Try to keep a regular sleeping and waking schedule. Even on weekends, reduce bright lights and screen exposure before bed. Avoid caffeine late in the day if it makes it difficult for you to fall asleep. Do not assume that poor sleep is simply unavoidable because you are getting older. Older adults still need restorative sleep, and waking exhausted every morning deserves attention. Tonight, begin with one simple adjustment. Choose a position in which you breathe most comfortably. Check whether your pillow keeps your neck in line with your spine. If you sleep on your side, place a pillow between your knees. If you sleep on your back, try a small pillow beneath your knees. If lying flat worsens reflux or breathing discomfort, consider gently elevating your entire upper body rather than stacking several pillows beneath your head. Avoid forcing yourself to remain in one position all night. It is normal for the body to move and change position during sleep. The goal is not perfection. The goal is support, comfort, and better breathing. It may also help to keep a simple record of how you feel each morning. Notice whether you wake with headaches, dry mouth, unusual fatigue, dizziness, shortness of breath, or difficulty concentrating. If a pattern continues, bring that information to your healthcare provider. And finally, everyone should know the warning signs of a stroke: sudden weakness or numbness on one side of the body, facial drooping, difficulty speaking, confusion, sudden vision changes, severe loss of balance, or an intense and unusual headache may be signs of a medical emergency. Do not wait for these symptoms to pass. Call emergency services immediately. Fast treatment can reduce brain damage and save a life. Your sleeping position is only one part of your overall health. It cannot replace blood pressure control, regular activity, a balanced diet, proper medication use, treatment for atrial fibrillation, or evaluation for sleep apnea, but better positioning can reduce discomfort, support easier breathing, improve sleep quality, and help you recognize symptoms that deserve medical attention. So tonight, do not become frightened about sleeping on the wrong side. Instead, make one thoughtful change. Support your neck more effectively. Loosen a tightly curled posture. Elevate your upper body gently if lying flat causes symptoms. Avoid a large meal or alcohol close to bedtime. Speak with your doctor if you recognize the signs of sleep apnea. A small change in the way you sleep may help you feel better tomorrow morning, and paying attention to repeated nighttime symptoms may help you discover a health problem before it becomes more serious. Your body performs some of its most important recovery work while you sleep. Give it a position in which it can breathe, relax, and truly rest.